Welcome to the final countdown. While the finish line of your pregnancy journey is within sight, there's still plenty of activity left on your to-do list. No, that doesn't just include picking out paint colors for the nursery. In the third trimester, you and baby will have some major milestones to cross off before the big day arrives. So, let's walk through everything you can expect during these final weeks. Here's what happens in the third trimester. First things first, let's talk about what's happening in there. As the third trimester begins, your baby is measuring around 19 inches long, about the size of a large head of cauliflower. By the end of the third trimester, however, baby will double in length and add several pounds. All that growth means your baby is storing up fat under the skin, which is a critical job that helps protect baby's organs and regulate body temperature after birth. In addition to filling out the bod, your baby will be working on other important tasks, like getting those little lungs ready for breathing on their own. The immune system will continue to develop as baby starts making antibodies against infections like RSV and the zoster virus. And those brain cells are multiplying rapidly. Yes, there are already hundreds of billions of them, and they're getting better at communicating with each other every day. Not to mention, baby's sense of hearing is fully developed, so you can chat to your little one to your heart's content. Plus, you might hear some practice vocalizations from the other side of the womb. We're talking grunts, cries, and maybe even a few hiccups. As the weeks go by, the room will get a little cramped as your baby plumps up. And that bigger size also means that you'll be feeling more frequent and intense kicks, jabs, pokes, and rolls. Yep, the famous fetal fireworks continue in the third trimester. Though the intensity might increase as your baby moves into the move over, I'm too big for this place phase, your third trimester to-do list, because baby's getting longer by the week. That growing bump might be causing some major backaches. So try to stay active with low-impact exercise like swimming, prenatal yoga, or walking. Gentle stretches might also help relieve some of that back and pelvic pressure as baby drops lower in your belly. As for your mind, it's a great time to mentally prepare for labor and delivery. One way to do that is by taking a childbirth class. Classes are offered in person or virtually. They're led by experts who can teach you the nitty-gritty details of the birthing process. It's not only that, but classes also give you a chance to role-play with your partner and ask any burning questions you have. You'll want to check with your insurance provider, but most plans cover the cost of childbirth classes if you have a high-deductible plan. See if your hospital offers financial assistance or discounts. Otherwise, community centers, birthing centers, and even YouTube offer free classes. While baby's getting comfy in your womb, you can take steps to make sure your hospital room is comfy too. Start packing your hospital bag early in the third trimester so you're not scrambling later on. It should include essentials like toiletries, comfortable clothes, nursing brass and underwear, diapers, wipes, and pacifiers. Oh, and don't forget the going home outfit for you and baby. Plus, it's smart to put together a list of everything else you need, like bottles, formula, or a swing. And speaking of being prepared, you'll want to schedule those remaining doctor visits. Your provider will keep track of your health and baby's development at appointments that happen every 2 weeks once you hit the third trimester. These checkups will include ultrasounds to monitor baby's growth and heartbeat, plus blood pressure and weight checks for you. The provider will also check baby's position and see if they rehead down and ready for delivery. Do you unhesitate to ask your provider about how to safely manage any symptoms or discomforts you're experiencing? For example, you can talk about ways to reduce swelling, find relief from backaches, or soothe nausea. And if you have a birth plan, bring it along and discuss it with your provider. After all, it's your right to make informed decisions about your care. As your belly expands, you may start feeling some familiar symptoms from the first trimester come back. Morning sickness, anyone? Don't worry, it's normal to experience the same symptoms you had earlier in your pregnancy, like nausea, fatigue, and breast tenderness. Those hormones are still surging. Plus, you're still growing, changing, and carrying extra weight. You might also have some brand new symptoms like shortness of breath. As your baby grows bigger, they'll put more pressure on your diaphragm, which is a dome-shaped muscle that helps you breathe. And that growing belly is getting in the way of that full, deep breath. So you might feel like you're constantly shallow breathing. Try turning onto your side or doing a pelvic tilt to give yourself some space. If that doesn't work, practice some prenatal yoga poses to open up your rib cage and promote better circulation. Swollen feet, hands, and ankles might also make an appearance. There's a lot of blood volume circulating through your body, and much of it pools in the extremities. The best thing to do is to rest your feet up and stay hydrated. And remember, those pesky hemorrhoids might flare up again too. On the bright side, by the end of the 3rd trimester, your baby will be preparing for arrival. They'll move into the optimal fetal position, with the head down, chin tucked, and the umbilical cord nestled safely beside them. During this time, your little one will also build up those fatty tissues, increasing their weight and helping them maintain a healthy body temperature after birth. Speaking of baby's weight, your provider will be monitoring it closely. Weighing in at least once a week, they'll look for consistent weight gain, which shows that baby is getting the nutrients they need. And as your baby plumps up, you might notice the room getting a little cramped. That's why it's smart to start practicing some breathing exercises now. Taking slow, deep breaths can calm your nerves and get you prepped for labor. Plus, they'll help you relax and manage any stress or anxiety that comes up. As you approach your due date, you'll start to wonder, is baby coming anytime soon? Well, here are some signs to look out for. Your water might break. You might experience bloody show or a mucus plug discharge. Your cervix will thin and dilate, and your baby will drop into your pelvis. Known as lightning, that last one can bring some relief to your breathlessness, but it can also cause pelvic pressure and some serious discomfort. Time to break out those pregnancy and labor support belts. And if you haven't started prenatal yoga yet, now's the time to get to it. Certain poses can help encourage baby to descend into your pelvis and make room for delivery. Just make sure to avoid inversions, hot yoga, or any poses that require you to lie on your back. Oh, and watch for signs of labor. The contractions are regular, occurring every 5 minutes, lasting 1 minute, and they get stronger as they progress. That's the 511 rule, which tells you it's definitely time to contact your provider. Once you enter active labor, you can expect the contractions to become more intense and they'll get closer together. If you're itching to meet your little one, you're not alone. But try to enjoy these final weeks and savor the anticipation. As you cross items off your Toto list, you're preparing for a big change, but you're also creating beautiful memories. Newborn season is coming up, so be sure to follow for more tips and inspiration. Thanks for watching.